Arthrocentesis or joint aspiration is an important diagnostic and therapeutic procedure for the emergency department. It may help differentiate the etiology of joint effusion and may provide symptomatic relief or cyst therapy by removing the offending material from the joint space. Indications for arthrocentesis include any joint for which removal of joint fluid will enable you to diagnose an infection, inflammatory arthritis, acute fracture, or to relieve the pain for a larger effusion. A similar approach may be used for injection of a local anesthetic or an anti-inflammatory medication. Relative contraindications include the destruction of the skin or the presence of skin infection overlying the area where needle would be placed, as it may increase the introducing the risk of infection and into the joint space, and the presence of coagulopathy is also a consideration, as it may increase the risk of bleeding into the joint. The procedure should be performed with sterile gauze. Equipment needed for the presence are clean gloves, square gauze, chlorhexidine solution, sterile drape, local anesthetic, 25 to 27 gauge needle with 50 with 5 cc syringe and 18 to 20 gauge needle for larger specimen and culture. Patient should be placed supine and the affected joint should be thoroughly inspected for the signs of infection. The procedure may be performed with knee extension or slight flexion. We will demonstrate the technique in full extension, which will allow for relaxation of the quadriceps tendon. The joint space of the knee can be accessed through several approaches, including medial or lateral, suprapatellar, parapatellar, and intrapatellar. Palpate the knee to identify the landmarks, including the patella, distal femur, and tibial plateau. Patella, distal femur, tibial plateau. Ultrasound will help to visualize the joint space and confirm the presence of effusion. It can also help to determine which approach to use for locating the largest and most easiest accessible fluid collection. Higher frequency linear probe assay transducer should be used. Raise the ultrasound probe over multiple potential aspiration sites to confirm the effusion and determine the best approach by which site has the most easiest accessible fluid collection. This probe is placed over the lateral patellar space with the probe placed towards the head. This is an image at the same peripatellar space with the largest effusion, the distal femur, any edge of the patella highlighted. Prepare the aspiration site using sterile technique. Inject the local anesthetic superficially, avoiding the injection into the joint space. If the infection is suspected, introduction of the anesthetic may cause false negative culture results. Place the USG probe so target area is visible. Line up the USG probe and the needle in line. As direct the needle towards the aspiration using the USG probe. Aspirate as much as fluid as needed for diagnosis or symptomatic relief.